For some reason, when this person bit down, these teeth fit okay into this bumpy little anterior plane that they had. So this is the NTI device that I made for her. I use a thermoplastic material, and we'll go through a little protocol of that in a second. As she bit down, I was concerned that there'd be too much vertical dimension, but I have her squeeze as hard as she can. It didn't bother her. I had her protrude, and she moved off to the side, hit one tooth. That felt weird, and it sort of felt weird around her cheekbones. Whoa, too much vertical on that one. That's with the discludium ramped down. Here's a side view of that. She had this big goofy thing when she came in, and this is the lower NTI device that I made, and she does fine with it, but I have to make sure she does all of the extreme excursions to see what's going to happen to her tonight.
Do you not trim that thermoplastic back?
No. I love, who said that? Do not trim that thermoplastic back. I love that stuff, and I used to have to because I would put too much in there. I hadn't done enough of them. Now I get it. It's like when the chef goes, oh, just take a pinch. Come on, how much do you really use? So it's about a teaspoon now I put into the boiled water. That's about the right amount. And if there's more than I need, I let that stuff go around the horn a little bit. I would much rather massage it and leave the excess and have ideal retention than to worry about cutting the thing back. Now, if the patient goes, oh, my friend's device doesn't look like, my friend's is really pretty and really clear. Well, I'll show you what an NTI-Plus looks like. Those are cool. Mine are big, goofy looking marshmallows, but they work great. But I'm a hands-on guy. I'm the other send-on guy. Everything happened on this one patient. He's got left joint pain, his joint's up there. Left joint pain, he's had lavage done in his joint. He's had failed splints. He's had a root canal done on number 18 twice, because that tooth is killing him. He's got left sinus pressure, chronic headache, stiff and sore neck, and frequent migraine. I said, well, you might need an NTI device. I bet you're clenching on number 18. He goes, you mean like the one I'm about to show you, this NTI device? Yeah. So first of all, make your jaw go over to the left. I bet you're clenching on number 18, and sure enough, he could do it. He'd squeeze on tooth number 18. Now, that is a contraction of the left lateral pterygoid, and now it's resisted. It's sort of like opening your mouth and pushing really, really hard, and you start to feel it into your sinus. I think that guy would go excursive, lock up on those molars, and squeeze like crazy. He pulls an NTI device out of his pocket and puts it in, and that device will relieve that point of resistance, and sometimes without the anchor, the mandible can go a little bit further. So when he put this device in, his jaw moved even more. He still had a place to contact. So that's why that's now at 19. His tooth felt different. He's got a different kind of a toothache, still has the sinus pain, still has the headache, still has the migraine. Because we still had the problem. Out comes my football diamond, and I'm going to relieve that point of resistance. And when I do that, he moved over even farther. But that didn't hurt him. He no longer had the ability to generate maximum clenching intensity in an excursive position. Fortunately, the vertical dimension wasn't a problem here. If it had, I'd start all over. But I like to take what the guy's got in his pocket and whittle on it or do a tooth and be a hero. My point is, the patient is a different patient every time you see him. Because if you've got a device going like this that's going to modify their ability, that means their ability is different. They're a different patient. You have to ask them to do things that they may not have been able to do before. He wants to know, when a patient's clenching in a centered position, are you kind of focused or worried about having both centrals, both incisors hitting simultaneously? Yes. And I don't have a slide. I'm so glad you asked that. We knock ourselves out to get perfect occluding on the splint. We've got the blue paper and the whole business to get it balanced. Now we're even thinking, well, an NTI, don't you want balanced? You got the two centrals. Sometimes one central's taller than the other. Sometimes it's, oh, great, I'll put it on the upper teeth instead, and now the lowers are jumbled all over the place. You can't get a nice balanced occluding scheme on an NTI. One central hurts more than the other. Why have I been so worried about that? I now make a, quote, slider on everybody. A slider is an NTI device without a discluding element and very, very thin occlusal coverage. So what I've created is a slippery plastic surface along the 8 and 9 edges, or 7, 8, 9, 10. Flat and slippery. A lower discluding element, boom, touches, they slide all over the place. So I actually put it both in at the same time and have them bite down. It's like, it's cheating. I don't have to be a dentist. I have to look about occluding schemes. It's great. Thanks for asking that.